Hello everyone, I promised my students that I would go over the lysosomal storage disorders in a video, so I'm keeping up my promise. And today we are going to overview the lysosomal storage disorders in one PPT to note what is most important about them. Just a side note, there are the different types of each of these disorders, so we are not going to go into details in this video. We are just going to go over and emphasize the most common clinical presentations of them. Okay, so let's go ahead and let's start. So, first of all, what is a lysosomal storage disorder? Generally, lysosomes are organelles in the cell that are responsible to break down any excessive waste product or any excessive non-functional or not anymore necessary materials and substances in the cell. If they are not working properly, and if they are doing so by enzymes, and they have lots of enzymes that destroy lots of different substances. But if any of these enzymes are deficient in the lysosome, that means that lysosome cannot function properly, and some of the substances are not destroyed, they are accumulated. They can be accumulated at different tissues in the different organs, and they can cause respective symptoms depending on which organs they accumulate in. Here we have to note about ceramide. Ceramide is kind of like a building block of our skin, and it is metabolized through different pathways by different enzymes. It can be metabolized into sphingomyelin, galactocerebrosidase, which again metabolizes into sulfatides. Ceramide can be metabolized into glucocerebrosidase and also into glucoside, which is further metabolized into gangliosides. Then all of these substances need to be metabolized further, and if they are not, they are accumulated and they will cause different disorders. So let's go over them. The first one that we have to discuss is GM1 gangliosidosis, and we are discussing the case first and then a little bit of explanation. An 8-month-old male infant presents with developmental regression and feeding difficulties. He was born at term with no complications and initially was developing properly. Over the past 2 months, his parents have observed a decline in his motor abilities, poor feeding, irritability, and a lack of visual tracking. What does developmental regression mean? Developmental regression means that child was developing normally, and for example 8-month-old male, 8-month-old baby should be crawling, should be sitting unsupported, even should be talking a little bit of syllables. So he should be interacting with people around him. He should be looking at subjects with interest. So he was doing all that, but he lost all of these abilities. He has decline in his motor abilities, so probably no ability to sit up, no ability to crawl, poor feeding, which also means muscle weakness, because eating needs muscles for a little bit of chewing, muscles for swallowing, irritability, and lack of visual tracking. Lack of visual tracking means indicates to vision problems, and that's why this baby does not look at something with interest and does not track the objects, because probably he lost the vision. On physical exam, his growth parameters are below normal, so he's small. Neurological exam reveals decreased muscle tone, which is also called hypotonia, decreased motor abilities, and poor visual tracking. Eye examination shows possible cherry red spot, and I want to show you cherry red spot. Cherry red spot on macula looks like this. So macula is part of retina, and retina is part of the eye, which is responsible for our vision, to put it as simply as possible. So macula is generally should be red color, but what happens when we say a cherry red spot on macula? It happens when these specific substances accumulate around the macula, and these lipid substances these are accumulated around the macula, and they cause paleness, whitish discoloration of retina around the macula. So compared to the surrounding, the macula looks even brighter red, and that's what we call cherry red spot on macula. Again, it's not the abnormality of macula itself, but it's an abnormality of the surrounding tissue which looks more pale than it should, and therefore the macula looks brighter red. That's what we call cherry red spot on macula, which is characteristic for a lot of lysosomal storage disorders and a lot of sphingolipidosis. Generally, we divide lysosomal storage disorders into sphingolipidosis and mucopolysaccharidosis. The ones that we are describing now is sphingolipidosis. At the end of the PPT, we will also describe two of the mucopolysaccharidosis. Sphingolipidosis is accumulation of sphingolipids, different sphingolipids, and mucopolysaccharidosis is accumulation of mucopolysaccharides. So what happens in GM1 gangliosidosis? As the name tells you, GM1 ganglioside is accumulated because of the deficiency of enzyme called beta-galactosidase. But where does it accumulate? It accumulates in CNS, retina, liver, spleen, bone, and connective tissue. So patient will experience the respective symptoms. Patient will experience neurological delay, hypotonia, decreased muscle tone, intellectual disability, seizures, meaning abnormal overactivation of neurons, cherry red spot on macula, which we already saw, coarse facial features. Coarse facial features means to put it as simply as possible, is when you look at the patient face and you know something is wrong. They have some kind of genetic abnormality. It does not indicate any specificity. It can be different with different types of dysmorphic features on the face, but this is when you look at the patient and you know something is wrong. They also experience hepatosplenomegaly because it also accumulates in the liver and spleen. Hepatosplenomegaly means liver and spleen enlargement. Next disease, we have Tay-Sachs disease. 7-month-old female infant presents with developmental regression and decreased responsiveness. She was born at term following an uneventful pregnancy and delivery. She was born at term means that mother had the full pregnancy without any complications, as it states here. Initially, she was developing properly, smiling, had head control, and sitting with support. However, her parents report that she has stopped babbling, can no longer roll over, has become less interactive over the past 2 months. They also note that she startles easily to sounds and has difficulty feeding. On physical examination, her growth parameters are normal. Neurological examination reveals decreased muscle tone and poor eye contact. Eye examination reveals a cherry red spot on macula, but no hepatosplenomegaly are noted or skeletal abnormalities are noted. So this is Tay-Sachs disease, in which the accumulation happens in GM2 ganglioside. So GM2 ganglioside accumulates. Why? Because there is a deficiency of an enzyme called hexosaminidase A. And primarily GM2 ganglioside in this case accumulates in the CNS and retina. That's why patient mostly has the neurological symptoms and there is no hepatosplenomegaly because it does not accumulate in liver and spleen. So symptoms go like this: developmental regression, muscle weakness, vision loss, cherry red spots on macula, and no hepatosplenomegaly. Next disease is Gaucher disease. A 3-year-old male presents with a history of progressive abdominal distension, fatigue, and frequent bruising. So, we probably know about bruising. Fatigue means tiredness, and progressive abdominal distension, abdominal enlargement, and distension can be caused by a lot of things, but a lot of times in the cases, they would indicate that it can be hepatosplenomegaly. So his parents report that he has been less active than his peers and appears pale. Paleness can be indicative of anemia, and frequent bruising can be indicative of thrombocytopenia. Let's look at what they are. Anemia is deficiency of red blood cells or deficiency of hemoglobin in the blood. And thrombocytopenia is deficiency of platelets. Red blood cells and platelets are blood cells which have different functions. Red blood cells mainly contain hemoglobin, and its main function is to deliver oxygen to the tissues. And thrombocytes are the blood cells which participates in creating of blood clot. And if thrombocyte has a problem or are deficient, there is a decreased ability to create a blood clot, decreased ability of blood clotting, and therefore there can be frequent bruising as one of the symptoms of thrombocytopenia. He had delayed motor development, and over the past year he has become increasingly irritable and complains of intermittent bone pain. On examination, the child appears pale and fatigued. Paleness and fatigue can be, and in this case is, the symptom of anemia, deficiency of red blood cells and hemoglobin in the blood. He has significant hepatosplenomegaly, enlargement of liver and spleen. He has multiple bruises on his legs and arms. Skeletal examination reveals tenderness over the long bones. Tenderness means pain when touched, pain during touching. There is no lymphadenopathy or neurological deficit. Lymphadenopathy is lymph node enlargement. So lab studies reveal anemia and thrombocytopenia, and bone marrow aspiration shows wrinkled tissue paper appearing macrophages. Macrophages are also one type of blood cells, white blood cells, because this substance can accumulate in macrophages. It can have the appearance with wrinkled tissue paper. This is how it looks under microscope: wrinkled tissue paper apparent macrophage. What happens in Gaucher? Accumulation of glucocerebroside because of the deficiency of glucocerebrosidase enzyme, which is or beta-glucosidase. Well, where does it accumulate? It can accumulate in bone marrow, liver, and spleen. Because it accumulates in bone marrow's function, bone marrow is located in the bone. So because of this accumulation of this substance in the bone marrow, patient has bone pain. But also, function of the bone marrow is that it produces blood cells. It can produce red blood cells, white blood cells, and platelets. Because bone marrow is not working properly here because of the accumulation of this substance, patient cannot produce normal amount of red blood cells and normal amount of platelets. So they develop anemia and thrombocytopenia, and as a result they can develop paleness and fatigue because of anemia, and increased susceptibility to bruises, increased bruising or frequent bruising because of thrombocytopenia. Next disease is Sandhoff disease. 10-month-old male infant presents with progressive developmental regression and hypotonia. He was born without complications and initially had normal motor development. Over the past 3 months, he had a loss of motor skills, increasing floppiness, and reduced responsiveness. The child has had difficulty swallowing. On physical examination, the infant has generalized hypotonia. Eye examination reveals a chariote spot on macula. So this patient was also developing normally but has developmental regression now. Floppiness means muscle weakness whenever the patient has inability or decreased muscles ability to move. So floppiness is when the baby is trying to stay passive and not move. And difficulty swallowing, generalized hypotonia, is basically a medical term of floppiness. Generalized means all over the body, and hypotonia means decreased muscle tone. What happens in this case? Accumulation of GM2 gangliosides, and it is quite similar with Tay-Sachs disease, and because in Tay-Sachs case also GM2 ganglioside accumulates, but also the enzyme that is deficient can be similar. This enzyme is hexosaminidase A or B, but in the case of hexosaminidase A, different part of the enzyme is deficient, different from the Tay-Sachs disease. And in this case, accumulation of this substance happens in CNS, retina, but also liver and spleen. So in addition to Tay-Sachs symptoms, which is developmental regression and hypotonia and seizures and chariote spots on macula, patient also develops hepatosplenomegaly because liver and spleen also experiences the accumulation of this excessive substance. Another disease is Fabry disease. 16-year-old male presents with episodes of severe burning pain in his hands and feet. Severe burning pain in hands and feet can be because of peripheral neuron damage, peripheral nerve damage. These symptoms magically, we call it peripheral neuropathy. This painful sensation is because of the damage of peripheral nerves, because one of the functions of these nerves can be transmitting the pain signals alongside with transmission any kind of sensation that we can feel all over the body. He reports increased fatigue, dark urine after exercise, and occasional abdominal pain. His medical history includes frequent unexplained fevers during childhood. On physical exam, he has angiokeratomas on his lower back and thighs, corneal opacities noted on slit lamp examination, which is eye examination by an eye doctor ophthalmologist. Cardiac examination reveals systolic murmur. Any kind of murmur indicates a heart valve abnormality. There are different types of murmurs which indicate different heart valve abnormalities, but we cannot go dive into the details right now here. But I want to show you angiokeratomas and corneal opacities. Angiokeratomas are the dermatologic or skin problem which looks like this because of the accumulation of this substance in the skin, and corneal opacities are looking like this, accumulation of the substance sphingolipids in here, in the cornea, which is the outermost part of the eye. Which substance is accumulated though? The accumulation happens of the ceramide trihexoside, which is also called globotriazyl ceramides, another fancy name. This is because of the deficiency of enzyme alpha galactosidase A. But where does it accumulate? it accumulates at different organs. That's why these people experience different types of symptoms. This substance accumulates in kidneys, which results into progressive kidney damage and eventually kidney failure. It accumulates in heart, which can result into heart abnormality, also called cardiac abnormality. It accumulates in skin, which will result into angiokeratomas, which we saw on the picture. It can accumulate in the nervous system, which can result in neuropathic pain, which was severe burning pain in hands and feet. And it can accumulate in the eye, but specifically in the cornea rather than retina, so it can appear as corneal opacities. It's not cherry red spot on macula, this is corneal opacification. Next disease is metachromatic leukodystrophy. 4-year-old female presents with progressive clumsiness, difficulty walking and frequent falls over the past 6 months. She was developing properly until age 3, after which she began to lose previously acquired skills, running and climbing stairs, which 4-year-old child already should be doing. Recently, she has also developed speech difficulties and behavioral changes. On physical exam, she requires assistance to walk as she cannot maintain balance. The substance that is accumulated here is cerebroside sulfate because of aryl sulfatase A deficiency. But it accumulates in CNS and PNS, so CNS is central nervous system and PNS is peripheral nervous system. And because of this, patient will develop developmental regression, hypotonia, decreased muscle tone, ataxia. Ataxia is inability to maintain balance while walking. And seizures, already we talked about it, and speech problems. Next disease is Niemann-Pick disease. 2-year-old male presents with progressive developmental regression, difficulty breathing, and abdominal distension. So we know where this is going. His parents report that he was a healthy infant until 15 months of age, when they noticed a decline in motor skills and a lack of interest in playing. They also report frequent respiratory infections and a recent episode of difficulty breathing. On physical examination, the child has hepatosplenomegaly, hypotonia. Eye examination reveals cherry red spot on macula. He appears pale and has mild bruising on his arms and legs. In Niemann-Pick disease, we have accumulation of sphingomyelin, and this is because of the enzyme sphingomyelinase deficiency. But where does it accumulate? It accumulates in the CNS, in bone marrow, lungs, liver, and spleen. So it results into respective symptoms. Because it accumulates in the liver and spleen, patient has enlargement of these organs, hepatosplenomegaly. Because it accumulates in the CNS, patient has respective symptoms, ataxia, inability to maintain balance, dysarthria, meaning speech difficulties, seizures, and cherry red spots on macula because of accumulation in retina. And because it accumulates in the bone marrow, patient can have anemia and thrombocytopenia, and therefore paleness and easy bruising. Because it can accumulate in lungs in certain type of Niemann-Pick, patient can have the lung problem and problems with breathing. Next disease is Krabbe disease. 6-month-old male infant is brought to the clinic for evaluation of irritability, feeding difficulties, and developmental delay. So developmental delays that we mentioned, I don't know if I explained it or not, is different from developmental regression. Developmental regression means that baby was okay until a certain age, but then they lost the abilities that they already had. Developmental delay is when the baby does not start gaining some new skills at the proper age, and they will gain these skills, either motor skills or cognitive skills, at the later age, or they will not gain it at all. The parents report that he was developing normally until 4 months of age, but since then he has become increasingly fussy and has stopped smiling or making eye contact. Over the past month, they also have noticed stiffness in his limbs and episodes of unexplained crying. On physical examination, the child is irritable with marked hypertonia in the upper and lower extremities. Hypertonia means increased muscle tone, but I want to note and clarify that neither decreased nor increased muscle tone is beneficial for working of the muscles. Both of them can be damaging, and both of them are impairing muscle work. In the case of Krabbe disease, we have the accumulation of galactocerebrosidase because of the deficiency of galactocerebrosidase. And this substance is accumulating in the brain, peripheral nerves, and liver. Symptoms are hypertonia, developmental delay, and seizures, and blindness, eyesight damage, feeding difficulties, etc., etc. This severe muscle weakness eventually will result into paralysis. This is the most prominent symptom of Krabbe until these children also have all of this, and also including Krabbe can have decreased life expectancy, and it will result in death sooner than the rest of the healthier population. Usually these children can die in the childhood age. Next disease that we have here is Farber disease. A 10-month-old female presents with progressive difficulty feeding, irritability, and swelling of her joints. Her parents report that she began to show symptoms around 6 months of age, with hoarseness, reduced mobility of her fingers, and painful swollen joints. Hoarseness indicates the voice changes whenever the voice kind of becomes cracked voice. Over time they notice the development of firm subcutaneous nodules over her elbows and knees. Nodule is the tissue growth of the skin or under the skin, which will result into an area elevated above the skin level, but it is the same color as the skin. Neurological examination reveals hypotonia. In case of Farber disease, we have the accumulation of ceramide, and this is because the enzyme acid ceramidase is deficient. But where do they accumulate? They accumulate, except for the CNS and lungs and liver, they accumulate in skin and joints. So symptoms will be respective. Because they accumulate in a joint, patient will experience painful joint deformities, and they cannot move their fingers, or they have the inability to move the joints. Because it accumulates in a skin nodules appear, and liver accumulation leads to hepatomegaly, enlargement of liver. Lung accumulation in the lungs results into respiratory, meaning breathing problems, respiratory issues, and CNS accumulation results into developmental delay. Okay, all of these were the sphingolipidosis, meaning different sphingolipids were accumulated, though the rest of the two disorders belong to mucopolysaccharidosis. So the first one is Hurler syndrome. 4-year-old girl is brought in by her parents due to concerns about developmental delay and frequent upper respiratory infections. The parent mentions that she had been progressing normally until around 18 months of age, when they noticed a regression in her motor skills and speech. On examination, the child has coarse facial features, which we already mentioned, including broad forehead, flat nose, and thickened lips. She also has a prominent tongue and enlarged liver and spleen. Her joints are stiff and she has a waddling gait. In Hurler syndrome, there is an accumulation of the substances heparan sulfate and dermatan sulfate. They are parts of the extracellular matrix, and this happens because of the enzyme alpha L iduronidase deficiency. Because Hurler has the Hurler, it should say Hurler here. Hurler has the L in their name. We can remember the alpha L iduronidase as it deficient here, and symptoms go like this: coarse facial features, which is that different abnormalities on the face, which we described in the case, and developmental delay. Hirsutism can be present, which means the excessive hair growth in areas where it's not supposed to be, skeletal abnormalities, airway obstructions, and clouded cornea. Also, hepatosplenomegaly, enlargement of the liver and spleen. And the last one is Hunter syndrome. A 7-year-old boy presents with progressive developmental delay, frequent ear infections, and coarse facial features. His parents report that he has had persistent cough and joint stiffness. On physical examination, the child has hepatosplenomegaly, broad nose, thickened lips, and enlarged tongue, which is coarse facial features. He also has limited range of motion in his elbows and knees, and his skin appears rough. In case of Hunter syndrome, there is accumulation of the same substances as in Hurler syndrome, heparan sulfate and dermatan sulfate. But enzyme that is deficient is different here. This is because of iduronate 2 sulfatase deficiency. These people, the Hunter syndrome, have the same symptoms as Hurler, but it is milder. And these people can also experience aggressive behavior. These people do not experience corneal clouding. Now you can imagine Hunter, we can remember it that hunters need their eyesight, they need their eyes to see. So these people do not have corneal clouding. Okay, this is the mnemonic wise, like kind of how we can remember which one has corneal clouding and which one has no corneal clouding. Okay, so these are the lysosomal storage disorders, most of the sphingolipidosis, and the last two are mucopolysaccharidosis. Feel free to rewatch this and pause anywhere to listen to it multiple times to remember the enzymes that are deficient here, substances that are accumulated, and why the symptoms are developing. If you have any questions, you can message me, comment below, or message me directly on the mail to clarify some more things. Thank you.